And we are live. Cool. Okay, let's see if this works. We're just experimenting, guys. Let's see. If I go here, if I log into Facebook. No, actually, this is what we want here. We are going to go to our... I know it's here somewhere. Let's see. Where did our most recent... And there we are. Cool. Let's see if this works here. We're just experimenting. I have 8 hours of recording. Cool. Slideshow, we're going to start from the beginning. All right, guys. So tonight we are talking about the degenerative cascade of the intervertebral disc. Thanks to Daisy Hudson. Daisy, thank you for coming up with this idea and for sharing your thoughts with us. And also, Terry, I believe. Terry, it was you as well. So thank you both for helping us come up with some ideas for us to talk about during this Friday evening. Guys, I want to thank you all for spending some of your Friday evening with me and learning about the spine and your own back injuries. I promise you that this is going to be a very valuable presentation. Thank you guys for being here. So 4 things before we start. Just things that I want you guys to know and keep in mind. If you zone out, you're zoning out because basically either I'm confusing you, you think the information is boring, you think it doesn't apply to yourself. So if you begin to zone out, please let me know. Holler at me in the comments and tell me to crack a joke or something, because it means that the message that I'm trying to throw at you guys and the education that I'm trying to educate you guys with isn't working. Okay, that's usually what happens. So let me know if that happens. Another thing, I would like you guys to ask questions when you feel like that question comes up, whatever it may be. I don't want you guys to think that, hey, this is that people might think I'm dumb if I ask this question. Even if it's just a simple question, please ask it, because by asking questions and by asking better questions, we get to learn a lot more from one another. And this is just for you guys, so make the most out of it, okay? Okay, another thing, we're going to keep this a very positive environment. I know I don't really have to explain this to you guys. You guys are all positive. You guys are all wonderful. You guys are all engaging. So thank you for being here. It's in other areas where you might have to be a bit more positive, okay? We're all here to learn from one another, okay? Uh, and last but not least, guys, all this information I provide for you guys completely free. It takes a lot of time to come up with this stuff, so I would highly appreciate that if you know of anybody who could benefit from this information and from this group, please, 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 please share this group with them. Tell them about this group. Like I said, it's all about educating others about the truth when it comes to lower back. So here we go. So today, what we're going to discuss are 6 different things. We're going to start by discussing myths surrounding back injuries, facts around lower back injuries. We're going to talk about the intervertebral disc and the structure of the intervertebral disc. We're going to talk about how the disc is injured. We're going to talk about the degenerative cascade of the disc, thanks to Daisy and thanks to Terry. And last but not least, we're going to talk about the ways to prevent back injuries and also recover from back injuries. So here we go. Let's get it, guys. Y'all still with me? So let's talk about some myths surrounding lower back injuries. So these are common things that people, that you guys, that we all tend to think about when we first hear that we've been diagnosed with a lower back injury, or when we hear things like degenerative disc disease or a herniated disc or a slip disc, or just in general, when we hear lower back injury, it scares us because it's something that most of us will go through at one point in our lives, whether you like it or not, and whether you believe it or not. So these are just myths and thoughts that come to mind when you hear the word lower back injury. So some common things include I will be in pain for the rest of my life slash my life is over. A lot of times we think when we get a lower back injury, when we experience all this pain, that we're going to have this pain for the rest of our lives. It's really scary for each and every one of us. Uh, PRP injections will cure me. So PRP injections, PRP stands for platelet-rich plasma injections, which is basically it's kind of like taking stem cells and inserting them into an area of injury. What these stem cells do is they promote healing and contain a lot of healing properties that sometimes in certain situations or in certain tissues help out a little bit. Another thing we think is I need to take medication to get rid of my pain. Uh, another thing we think is I need a steroid injection to be able to get rid of my pain and back injury. Uh, we also think that sometimes surgery is the only solution. Uh, Another thing that we think is, or some people think, is my disc will grow back again. Another myth that we might believe is that we won't ever be able to lift or exercise again like we used to, and that we're going to have to sit down and lay down for the rest of our lives. And the last myth that we tend to believe, or that a couple of us, uh, maybe we've heard of this situation, is that a total disc replacement will cure me. So now we're going to move on to talking about a couple of facts when it comes to talking about lower back injuries. And these include basically the opposite of the myths that we just described. So when you have a lower back injury, your life is not over. You can be 100% pain free. I am literally living proof that you can be pain free, guys. I experienced pain for 2.5 years and I struggled so much. But if I overcame it, guys, I promise you, you guys can as well. If you follow principles that it comes when healing your lower back and also preventing lower back injuries. You guys can do this, okay? Your life isn't over. Take this as a little bump in the road. Take this as the universe or God throwing something at you, saying, hey, let's see if you can get over this. And I promise you guys, you can. You just have to make the decision that you're going to do no matter what it takes to overcome your back injury and become pain free. And you can't believe what the doctors say. You can't believe what the surgeons say. Sometimes, okay, some doctors you can believe, other doctors you can't. In any area, in any work field, in any work environment, you're going to have, um, you know, people who aren't so good at their job or who have lost motivation for being good at their job, and then you're going to have others who are complete completely amazing at their jobs, to be honest with you. uh, but a lot of times you see people who are unmotivated, um, and just aren't very good or satisfied in their jobs, and these people are going to tell you things that you can't always believe. Okay, so let's go on to the next one. The next one, the truth about PRP injections is that in some cases they might minimally help, and this is in injuries that they're more acute injuries, and acute injuries is basically an injury that just occurred. Okay, and PRP injections may not necessarily help in the back because the back is different from many of the other tissues and areas of our bodies. The back isn't a shoulder, the back isn't a knee, the back isn't an ankle. The back is a very um, heavily weight-bearing area of our body, and it doesn't work the same way other areas of our body works. Okay, let's go on to medication. So medication only masks the pain, guys. Um, I'll give this example. My uncle, he described this perfectly well. My uncle's an electrician, and he worked outside. He did heavy labor. He always does heavy labor, and he had back pain at one point, and he would tell me, this was when I was younger and I didn't know much about lower back injuries. He would tell me, "Hey, I had back pain once, and I would take all these medications. I'd take Tylenol. I'd take Aleve." Uh, and it temporarily helped me, but then I'd feel worse afterwards. And why would you feel worse after taking medication? It's because medication might mask the pain temporarily. And while the pain is masked, you might do some activities or do some exercise or do some movements that might actually be triggering your lower back injuries. And you might push into the pain, but it's being masked by the medication that you're taking. And then later on down the road, you feel worse because you didn't realize that you were doing things that contributed to your pain, right? Another thing about medication is that quite a few people, especially here in the US, a lot of people are addicted or become addicted to pain meds, and that's something that we have to consider and watch out for. Like literally, the pharmaceutical injuries whole basis of existence and of being in business is trying to make people take pain meds. Like they're literally selling you all these pain meds, and sometimes these pain meds come with a lot of side effects. And these side effects aren't the best. Like some cause dizziness, some cause irritation to your stomach, irritation to your intestines. They cause bodily changes over the long term. It's not very good, guys. So I want you to consider that and think about that when it comes to medication. Let's talk about steroid injections next. So, steroid injections work sometimes, but not all the time. In me, it didn't work. And somebody else, it might work. And Catherine just had a steroid injection and she says that it worked. It's actually helping her. It all depends, guys. It all depends. Sometimes they work and sometimes they don't work. So, let's talk about surgery up next. So, people who have surgery typically have further complications later. And this is because, while surgery might help temporarily, you're not getting rid of what originally caused your back pain. So we'll talk about that a little later. And typically what causes your back pain is just inappropriate movements, moving inappropriately, moving in a manner that stresses your spine. And if you don't take away those movements that stress your spine excessively, then surgery isn't going to do much. Surgery might help temporarily, but later on down the road, you're going to have to have another surgery because you didn't take care of the original cause, the reason why you had a herniated disc or a back injury or sciatica in the first place. You're just going to re-herniate or uh, re-injure the area that you had injured before. Um, and on to the next one. So there is no scientific evidence that a disc can regrow. um, I have found no evidence that a disc can actually regrow. It's tough. Once a disc begins to be injured, it leads down a different road. So a disc can't actually regrow. It's very and it's very how uniquely made. It's a weight bearing tissue. It's very hard to regrow a disc if you can even do that. And from what I've seen, I have never seen a disc that can actually regrow. Um, so let's move on to the next one. Um, a fact surrounding lower back injuries is that you can eventually lift and exercise. You just have to be careful. You just have to be more aware of your movement patterns and more aware of the things that cause your pain. Some people get pain when bending over, some people get pain when extending. It all depends. You have to know what exercises contribute to your pain and what exercises help your pain, and you have to adjust accordingly. So you can still eventually lift and exercise. I'm also living proof of that. I've been able to do a 13.1 mile half marathon, right? Not just anybody can do that. Your typical person who exercises can't do that actually. And I am somebody who had a lower back injury, and I was able to complete that. And I beat three-fourths of the people that were in the run. I was in the top 25% of finishers. It's amazing, isn't it? It's amazing what you can do with the body even after you've been injured or had a severe injury. It's beautiful. I mean, like I think it's just beautiful how we're each able to adapt to the stresses that we're given in our lives. Like man, it's just wonderful. We're wonderfully made, guys. Like we're made to adapt. It's beautiful. So, like I said, you just got to be careful when you lift and exercise. You can still do it eventually. Now, I'd say don't focus on lifting and exercising initially if you have back pain. Focus on getting rid of your back pain and then worry about lifting and actually exercising. Okay. And let's talk about the last one. So I've only heard a few people talk about these, but I wanted to mention it because it is, I mean, it's there, total disc replacements do exist. And I think it is an option to talk about. So total disc replacements later on the road, they cause excessive mobility. And because it's a weight bearing area, the spine is weight bearing, excessive mobility combined with load can lead to difficulties later on. You might jack up a bone in a certain way. You might start stressing bones in a certain way. Um, excessive mobility leads to further breakdown. So that's something we'll have to, keep taking a look at. Not many people get total disc replacements. I haven't heard of many successful ones. I actually haven't even heard of a successful disc replacement later on down the road. But we'll keep that option open. And let's keep going with this, guys. Are y'all still tuning in? Are y'all still getting this, guys? Let me know if there's anything that you guys don't understand, and I'll go back and review it. Okay, this presentation was made for you all. So, what exactly is a disc? So let's talk about this first. So the spinal column, which is this entire thing right here, is made up of bones and discs. The bones are called vertebrae, and they're these right here. And then the discs are the structure that's in between each bone. So this right here. Some people say the disc is kind of like a jelly-filled donut, or kind of like a tower, a tire, a car tire, or kind of like a little balloon that's in between each disc. Um, And the disc is kind of like a bone spacer. So you see here, it's keeping the space in between the bone. It's also keeping pressure off the nerve here. The nerve has room to breathe. This yellow area here is the nerve coming out of each segment. And it's made up of collagen. So collagen is a very thick tissue. It's a ligament. It's very, very thick, and it's protective. It's very durable. It's very hard to what's the word, to break this sort of tissue down, but it's possible, and it's what can possibly happen when you have a back injury. Another thing to note is that it's a highly pressurized uh, tissue. The disc, there's a lot of pressures going on. That's why you have people that are able to lift like 600 plus pounds. That's why you have people who are able to power lift and weight lift extreme loads, but it does take some time to be able to build up to those loads. Yeah, so that's kind of the structure of a disc. We're going to dive into it in a little bit and get a little deeper into the actual anatomy itself of the disc. So here we go. What is a disc made out of? There's three different sections of the disc. Okay, we're going to talk about two here to start off. Oh, I gave this little example of the Grave Digger. The Grave Digger used to be one of my favorite monster trucks as a child. I had a toy monster truck of the Grave Digger. Grave Digger. It brings great memories to me myself. And then also my brother. My brother had this little toy monster truck called El Toro Loco. So my thoughts are that that was his favorite monster truck of all time, and it was a really cool monster truck too. So back to talking about the disc. So the disc, the outer portion of a disc, it's right here. So if you see my mouse around here, the outer portion of a disc is called the annulus, and it's made of really, 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 really tough outer rings. So you see all these rings, and each ring is shaped in a different direction that protects uh, the disc when you move in certain manners. So some fibers help when you turn one way, other fibers help when you turn the other way, other fibers help when you flex, other fibers help when you extend. They're all just shaped differently. So in summary, that's the outer portion right there. And it's very, imagine like the outer portion of the disc being like rubber, like very, very thick rubber, layered rubber. That's kind of what it is. And then we have the inner portion of the disc, which is called the nucleus. And this right here is more like a really thick jelly. Imagine like, have you ever like had a sickness, maybe like uh, where you cough off like cough up a lot of like phlegm or sputum, you know, that nasty sticky stuff that comes out of your mouth. It's pretty gross. That's kind of exactly what the nucleus is. And this area of the disc is where it's very, very highly pressurized. Like imagine like a car tire. So that's why I gave a picture of this monster truck. Imagine like this monster truck's tire. It's very pressurized inside, right? Um, and it's able to sustain load for that reason. Okay, we're going to talk about the third section, and not a lot of people talk about the third section. So the third section is this little area right here. If you see my mouse, I'm over here on this right side. It's right above the disc. Well, it's right in, it's on top and below the disc. This little slither of flab, whatever it might be, this right here, and that is the end plate layer. So right here, here's a good example. Here's the disc, and then you have the end plate layer, and then you have the bone. And basically, the end plate layer is what keeps the disc attached to the bone. It's also something that that may be injured as well sometimes in very particular instances when people lift loads of weights and they're not prepared for it. Sometimes the disc actually herniates into the bone. Kind of crazy. Um, but it takes a lot of forces for that to happen. It usually happens in people that lift a lot. So yeah, like I said, this area is rarely discussed. It is made up of cartilage as well, pretty tough cartilage, and it helps connect the vertebrae to the disc. Now, what exactly does a disc do? Well, guys, it allows for your spine to move, and it also allows for the ability to bear some load through your spine. Uh, and the more load that is pushed or pressed down your spine, so imagine like lifting or having like 100-pound weight on your shoulders that you're carrying around. That'll cause the disc to naturally pressurize against the load. It's pretty cool in a healthy disc. Okay. Mhm. Discs also come in a variety of shapes and sizes. It all depends on your body type and your anatomy, your structure, and also your genealogy, where you come from sometimes. So sometimes you have oval discs like this one right here in the middle, and these are typically in slender individuals. An example of somebody who is a slender individual is somebody who does a lot of yoga, a yogini, a yoga expert, or somebody who plays golf, like Tiger Woods, for example. Uh, those types of people are usually pretty good with mobility in their spine. And then over here we have instead a limacon shaped disc, which is kind of shaped like a lima bean. And these are typically in more thicker individuals, people like linebackers or even sumo wrestlers. And, you know, depending on the shape and the size of the disc also depends on what kind of injury you have, interestingly enough. So, in people who have these oval shaped discs, they have more spread out disc herniations. And in people with these limacon shaped discs, they have more focalized disc herniations going out to one side or going out to the other side. And if you don't know what a disc herniation is, we'll learn about that soon. Okay, so disc herniation is basically when the nucleus slowly begins to migrate outside and break through the walls. It begins with breaking through the walls of the annulus, which we just talked about, the annulus, and eventually it pushes out, and sometimes it compresses on a nerve or different structure in your spine and may cause pain. Um, So the reason why I put the Greyhound here and Beethoven, this makes me think of Beethoven, this Saint Bernard. Have any of you guys ever watched the movie Beethoven? I watched it like once. I barely remember it. Is Greyhounds? Greyhounds were made to run fast. So greyhounds, imagine greyhounds training in a certain way. They're made to run fast, right? But a greyhound can't be a Saint Bernard. It can't lift a lot of weight. So imagine a greyhound being like somebody who has a slender disc, somebody with a slender or an oval disc. Somebody with an oval disc might be able to move really well. They have a lot of mobility in their spine, but they won't be able to be like a Saint Bernard. A Saint Bernard is able to lift loads of weight. Saint Bernards, imagine them having more limacon shaped discs like this right here. Um, so, like I said, it all depends on the way you're shaped, your God-given anatomy. It all depends, guys, on the type of injury you have. So, just like the Greyhound isn't able to lift a lot of weight like the Saint Bernard isn't to run or train like a Greyhound is. If you tried to make a Saint Bernard run, he would gas out, he would tire out, and it would slowly break him down. It wouldn't work out because a Saint Bernard isn't a Greyhound at the end of the day, and vice versa. So that's kind of what a disc does right there, guys. So let's move on, and we're going to talk about how a disc is injured. So usually, when you have a back injury, it might begin as a little muscle strain. Let's go back here. It might begin as a muscle strain, and then eventually might get a little deeper. So you might wake up with a sore back, and then later on, if you keep pushing it, if you keep injuring it, and a lot of times we injure our backs and are doing things to injure our backs without even knowing it, which is really crazy. The disc, a disc, you really don't know. A disc could be injured for a while and it might not give you pain until a certain point. So you could have a disc injury going on for years and it might not give you any pain, and then the minute it gives you pain, it's 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 pretty intense. So usually you have a muscle strain, and then usually later on the disc becomes affected. So this is what causes a disc to be injured. In summary, excessive mobility at the spine, and this includes excessive flexion, which means that you're bending forward over excessively, excessive extension, which means that you're extending excessively, kind of like a gymnast would do, and that causes a certain in each of these movements causes a certain type of injury, interestingly enough. And also twisting excessively causes may cause injury as well. The fun fact about twisting is that when you twist to one side, basically half of your disc is protected, and when you twist to the other side, the other half of your disc is protected because those outer rings of the disc that we talked about earlier, some of them get tight and some of them loosen up when you twist. Now remember, the key word to consider here, guys, is that all of this is with excessive movement, so too much. And we're talking end range flexion, end range extension, end range twisting, okay? You can do moderate things, like everything in moderation, but just don't push it excessively, especially if you're lifting weights. So that's the second portion here. Excessive loads may cause injury to a disc if you have bad form. Um, and if you involve excessive loads or excessive weightlifting or lifting anything, along with excessive flexion, excessive extension, excessive twisting, it only compounds the chances and likelihood of you getting an injury. So move with great pristine posture to combat this. Another reason why the disc is injured is um, because eventually it becomes unable to adapt to the stresses that you're giving it throughout your day. And if we can't adapt, we end up breaking down. What is a stress? A stress is basically anything that causes increased, what's a good word? Increase, man, what's a good word for stress, you guys? I don't know. I don't even know here. I'm at a loss for words here. Y'all help me out. Y'all comment. What's a good comparison to compare stress to? Um, it could be a lot of weight on your back. Um, and yeah, discs have a lot of difficulty adapting. Why do they have a difficulty adapting? It's because they're ligament, and naturally, when you hear the word ligament, ligaments don't have a good amount of blood flow, so it's hard for them to recover. Blood flow carries a lot of nutrients that allow for healing um, throughout our bodies, and that's something that ligaments don't have. Let's continue. Oh, here are some different movements to avoid or to prevent back injuries, and to avoid when you're having back pain. All of these people are an increased likelihood of having a back injury. So first, we'll look at this first one here. Look at his spine. He's lifting what looks like 20 kilograms. That's about 135 pounds, I want to say. More probably. And look at him. He's flexing his spine, guys. Imagine how much stress there is through his spine right here. He's at a higher risk for injury. This gal, too, is at a higher risk for injury. These gals, gymnasts, have a particular injury called a pars fracture, typically because they have excessive extension. Let's take a look at this guy. This guy, I promise you, if you have a back injury, you would probably not be stretching like that because it'd cause you a lot of pain, especially if you're flexion intolerant. So in this position right here, he is causing a lot of strain to his sciatic nerve. Man, I would not be able to do that. Jeez. And another thing you got to ask is why do you need to stretch like that? Like, um, I always say, like, train to what you do in your everyday life. If you lift 400 pounds in your everyday life, then for Pete's sake, training to be able to lift 400 pounds. If you have to get in awkward positions, train to get in awkward positions. But like seriously, guys, when on earth would you naturally find somebody using this position that this guy on the black over here is in? That's insane, isn't it? What do you guys think about that? Um, this is not a good machine as well. It's supposed to train your obliques, but it really doesn't train your obliques. It actually causes a lot of strain to your spine. Like I said, remember, excessive twisting causes half of your disc to be tightened and the other half to be loosened. So basically, half of your disc is working, half of your disc isn't. This guy here is doing what's called a Russian twist. When you do these right, it prevents movement from your lower back, but I think this guy's moving from the lower back here. I do not recommend doing those at all, even if you don't have a back injury. There's better things to do, better exercises to do instead of this, which increases your likelihood of having a back injury. And then this lady, she's stretching, but that's not a good stretch. Um, there's too much twisting going on in her lower back, and you could tell, like, look at the hip right here, the little bump right here, the little curve. So yeah, guys, all of these movements here, I would recommend not doing, especially if you have a back injury. Now, guys, you have all got full permission. You can go and try to do this. Um, challenge me if you would like, or, discuss this with me if you would like, but I can almost guarantee you if you like do any of these movements on a daily basis, you will eventually have a back injury. So let's not do those. Okay, let's keep going. So now we're going to talk about once a disc injures, what happens. So once you have a disc injury, what exactly happens? Um, so basically, the nucleus here. Let's go to this top picture first. Okay, the nucleus. You see it right here. It's right in the middle. The nucleus begins to push out and slowly delaminates the outer layers of, the inner layers of the annulus. So it starts moving out to one side depending on the movement and the load that you're giving it. So you see this one here, you have the normal disc, and then it slowly pushes out, it tears through the annulus, and then eventually it tears through the entire annulus and the entire disc, and you have a herniated disc. And the way that it pushes out depends. Usually it pushes out towards the back of your spine, so it may start compressing your nerve, like it is here at this bottom picture here. So here's the normal disc. Then you go to the second picture, and it has slowly delaminated the outer layers of the disc. You see it, and it's pushing out into this red area, and now it's pushing out to a nerve, and this person might have some nerve pain or radiating pain going down their leg. It could be pain in their butt muscle. It could be pain in their hamstring muscle, the back of their leg. It could be pain in their calf muscle, or it could even be pain down to their ankle. And that's not a fun thing to experience, guys. And we keep moving. This guy has a full-blown, or this guy or gal has a full-blown herniated disc. And yeah, probably has a lot of pain too. So in some cases, the disc will herniate out to the top. This is typically only in lifters who lift a lot of load, or in somebody who suddenly jumps and just pushes a disc up into the air, or pushes a disc up into the actual bone itself. It's very hard to do, but like I said, it typically happens in lifters who lift a lot of weight. So yeah, once a disc is injured, basically the nucleus begins to push out on the walls of the annulus portion of the disc, and eventually it herniates. So it's kind of like a car tire. Imagine a car tire slowly being deflated. Now, it's not this far gone, okay? When you have a deflated car tire, what happens? It messes up the suspension and the drivetrain of the entire vehicle, right? You might have one side of the vehicle leaning to one side versus the other, and that's exactly what happens with us in our backs too, if we are not careful. So the disc or the car tire begins to lose pressure, and then everything starts behaving differently. And because everything is behaving differently, you might have some slight aggravation to other areas of the back, not just the disc. So other areas that might be aggravated include ligaments, other ligaments, the facet joints, your nerves. That's why you get sciatica, and the spinal cord. And when you have aggravation to spinal cord, is not very good. This is when you get crazy things like you not being able to feel your leg, or you not being able to use a bathroom properly, or not being able to feel your pelvis area. This is emergency right here when it's actually on your spinal cord. Guys, you really got to be careful with that. Facet joint pain, or facet joint aggravation comes later on down the road once the disc has been pretty flattened. And what facet joint aggravation feels like is it feels very pinpointed pain to one side of your back or both sides of your back. It all depends. It's very, very pinpointed and focused and intense pain that causes you to kind of stop in your tracks sometimes. So as I said, once a disc is injured, yeah, it's like a car tire losing air pressure. It slowly begins to flatten out. And it is you can slow it down and you can stop it, guys. Okay, don't be afraid when you hear disc degeneration or stenosis or all those medical terms that people throw at you and that healthcare practitioners throw at you. Don't be scared of that. So another thing that happens when the disc becomes injured is that it slowly begins to lose some hydration. This is another reason why it loses some pressure. But the thing is, when it begins to lose hydration, it actually calluses and becomes thick and tough and very resilient. And this process could take up to 10 years to happen. Now, Keep in mind, you do have to, you do have to rest. You do have to note the amount of stress you're giving your disc. You do have to allow your injury to heal. Otherwise, this doesn't properly happen, and you might get more breakdown in the tissue and in the disc itself, which you want to avoid at all costs if able. But sometimes you can't avoid it. Sometimes you do need, things like a spinal fusion or a surgery. Okay, especially if you're not able to get rid of the pain, especially if the pain is there 24/7, especially if you can't find a position that causes you to be able to give you relief. That's when you have surgery. So let's move on and talk about the actual degenerative cascade of the disc. So over here, let's look at this right picture over here, the picture with the actual color in it, not the black and white one. Okay, guys. So we're looking at this picture over here, and remember, this is a possible cascade. It is preventable. It is able to be stopped. It is able to be controlled and maneuvered. Okay. So what happens is the disc basically begins to slowly lose height, lose hydration, and it may begin to affect adjacent meaning nearby uh, adjacent structures, and it might eventually begin to grow osteophytes at its lowest, or as it progresses. Um, the more it progresses, the more likely it is to grow osteophytes. Osteophytes basically means that it begins forming bone and bone deposits like this down here. And the reason why it begins to form like bone deposits like that, the reason why osteophytes begin to grow in the first place is because it's your body's way is of basically trying to stabilize a joint naturally. It isn't a bad thing. It isn't something to be afraid of. Um, it's just your body's way of trying to combat instability. Now, another way you can combat instability is basically by ensuring that your muscles work properly, because your muscles are able to produce and protect your spine and produce stability, like literally. Like, so hypothetically speaking, if you use your muscles to stabilize the joint, then hypothetically speaking, bone doesn't have to form like this. Osteophytes don't have to form to try and stabilize because your muscles are doing a good job of stabilizing your joints. So let's look at this picture over here. We went on a tangent there. Sorry about that, guys. Guys, please comment. Is this helping you guys out? Are you guys understanding things? Do I need to dive into anything a little bit more deeply? Y'all let me know, okay? So here's a normal disc. Here's a disc that's beginning to slowly degenerate. You might begin to have a slight back injury here. You might have some back spasms. You might have um, this is, this might look like a disc where somebody had lifted a lot of weights and has a really sore back one day. And then we get lower and the disc starts bulging, might begin to impinge on a nerve here. And then you actually get a disc herniation and you're probably impinging on a nerve here. And then after that comes a thinning disc where it's really losing its hydration. It's getting smaller basically. Um, and then you have actual disc degeneration with some osteophyte formation. Like I said, don't be afraid of this right here, guys. This is preventable, and a lot of people who actually have disc degeneration don't actually have pain. Quite honestly, um, surprisingly, bodybuilders and powerlifters and Olympic weightlifters have some osteophyte formation because they have to grow thickened bones, and lots of times they have pretty bad back injuries, but are still able to lift incredible amounts of loads and are still able to be pain free, interestingly enough. And this over here, this picture right here is an actual MRI of Dr. Eric Goodman, who is the leader of foundation training. Uh, you guys can try foundation training if you want. I didn't really agree with the concepts. I think it actually leads to further tissue breakdown. But this is his spine. If you see his lowest vertebrae, L5, S1, you can't even tell what's going on there, guys. It's so smashed. But yet, this is a guy who has no pain. but still I wouldn't recommend trying out foundation training. It's not scientifically proven. Okay, let's move on. Now we're going to talk about how to prevent / recover from spine injuries. So first, it begins by making a decision. Make a decision that you will come back from your back injury no matter what. Second, know that disc degeneration can be slowed down / stopped by following the right principles and respecting your body's limits and knowing what to do and what not to do. Another way you can prevent / recover from back injuries is to give your body appropriate stresses and time to adapt. Make sure that you rest. Learn to move properly. A lot of people don't move properly, and that's the main reason why you have disc injuries and back injuries in the first place. Make sure that you exercise with amazing and pristine form. By exercising in this manner, you are optimally loading your body and setting yourself up for success, whether that be with movement or exercise. And lastly, you must become aware of what positions your body is in. By becoming aware, you're able to address things. If you aren't aware that you're moving improperly or flexing or, moving in manners that cause pain later on the road, you're not going to know how to fix it. If you become aware, you have an opportunity to fix things. All right, so let's go on. The same way you rehab back injuries is the same exact way that you prevent them. Literally, you guys. Just that most people don't try to prevent back injuries or have great pristine form until they actually have a back injury. Interestingly enough, which that's just human nature. We always wait till last minute to do things. We always wait till we're really, really hurting to try to change things in our life. We always wait till our significant other tells us that they want a divorce to go back and try to fix relationships. We always wait until we're really, really hurting to try and change things. So do not do this. I recommend, even if you aren't having a back injury, to follow the principles that I share in this group. Being 100% honest here. So, okay, that is the end of tonight's Friday Night Live. I hope you guys enjoyed it. Do any of you guys have any questions, comments, or concerns? Please share those questions in your comments and I will answer them accordingly. Like I said, guys, thank you so much for being on here. I hope that this stuff is helping you guys out, and I hope that you all are understanding it. If you didn't understand things going on here, please let me know. If I bored you to death, please let me know, because I might have done that. Not everybody is as interested in the back as I am. Y'all let me know, guys, okay? We're going to move on and talk about questions that were asked in the group this week. So these are coming from people within the group, and also before people are accepted into the group, there is an opportunity for them to ask questions, and these are some of the questions that were brought up there. So Laura, you're a speech pathologist. I've worked with some cool speech pathologists in the past, so thanks for what you do. Laura says, I'm still figuring out what it means to have chronic pain and how to best manage it. So chronic pain, Laura, is basically, it's generally defined as pain that has been going on for more than 3 months, or at least 3 months. And basically, when you're in this state of pain, your central nervous system, so your brain, areas of your brain are just lit up, and typically for people who are in chronic pain, any little thing lights them up or flares their pain up. The easiest way to understand the chronic pain is, imagine that you were to stub your biggest toe into a dresser. It caused quite some pain initially, right? Now imagine if you would constantly stub your toe into a dresser. So you're kicking that dresser. Eventually, that toe would be highly sensitized to the point that if I were to even barely touch it, it caused immense pain. That's what being in chronic pain is like. It's just, pain where any little thing flares you up. Let me know if that made sense. So Duan, or is it Duan or is it Dwayne? Please let me know if I'm getting that properly. I'm sorry if I butchered a name. Duan says, I have a herniated disc 8 weeks after second medical medical doctor visit. Let me know if that made sense, if I'm saying the question that you gave me properly. Okay. Um, Duan, I recommend trying to see some of the videos that I've previously made in the group. Go check out the units area and see if you can go through those videos. I literally take you through a step-by-step process on how to get over your back pain. All you need is a little bit of time and willingness to go through those videos and understand and just learn from those videos and apply. Dewan, something you could also try to do is see if you can lie down on your stomach with a pillow in between your hips and do some light belly breathing. And if that feels good, see if you can do some light press ups as well. And some people that makes things better, and other people not so much. It depends on your type of injury and the extent of your herniated disc. Jennifer M says, how to make it stop for good. Jennifer, I recommend beginning by figuring out what positions are causing your pain and trying to eliminate those throughout your life and throughout your days. For a lot of people, it could be sitting. I also would recommend go check out the videos that I've made previously in the units area. Um, you can you can make pain stop for good if you follow the principles it takes to overcome a back injury. All right, it's it's a general answer for everyone. The hardest thing for people to do is actually follow the directions when it comes to getting rid of back pain and actually following through with the information and actually doing the exercises and applying everything to their lives. It's a lot easier for somebody to go get surgery, but later on down the road, you're probably going to have another surgery if you don't address the cause, which the cause is usually to move better and move in a better manner that causes less stress to your back. Rima says, I'm looking for help to release pain from my buttocks going down to my leg. So Rima, that's basically radiculopathy, or otherwise known as sciatica. The way you know you're healing Rima is if the pain begins to go back up your leg. So if it kind of regresses, if it goes from your ankle back up to your calf, or from your calf back up to your hamstring, or from your hamstring back up to your buttocks, or from your buttocks back up to your spine, that's how you know that you're really, really beginning to heal. I wouldn't recommend any stretching for you right now, Rima, because stretching might actually aggravate your back pain even worse and your leg pain even worse. So I'd say avoid stretching. If you don't have pain going down one leg, see if you can stretch the leg that has no pain. That might be a good idea to start. And I also would recommend seeing if you could tolerate lying on your tummy, because that is generally a good position for people to begin to be in, that relieves some of their pain. So try that out and tell me what you think. And again, everyone, please let me know if the answers that I'm giving to your questions are all making sense. So Chin P asks, what is the possible reason for chronic pain? So chronic pain, like I said earlier, chronic pain is basically a state of pain where your body is very, very sensitized, where any little thing might cause pain. It's kind of like you chronic pain is basically being in a pain where any little thing causes your pain, and your body thinks that any little thing that's causing your pain is actually causing injury to your actual body, when sometimes it isn't. Sometimes you're just super, super, super sensitized to any little movement. You've irritated the area of injury, whether that be your back or your knee, for so long that any little thing now causes pain. That's basically what being in chronic pain is. Chin, let me know if that made any sense. And guys, if any of you would like, feel free to reach out to me in my DMs for more clarification or for more in-depth information or for more details, okay? Y'all feel free to reach out to me. Melissa H says, how does it start / get triggered? So Melissa's asking how back pain starts or gets triggered. Melissa, basically back pain starts by you not moving properly and causing increased amounts of stresses to your lower back, and then eventually structures begin to be irritated and break down. That's kind of how back pain starts. So questions for this week continued. We got lots of questions this week. So Catherine asked, I understand why I feel so much more pain in my back. Great, Catherine. I'm glad you do. We've been going through things quite a bit, and you've been applying the information, so congrats on you for doing that. Question is, if my herniation is on the left side, why am I feeling the pain more intensely on the right side of my back? Also, why are my shoulders getting sore and my upper arms? I honestly don't know why your shoulders and upper arms might be getting more sore, Catherine. I'm sorry I couldn't give you a better answer than that. It could be that you're using them a little bit too much and your muscles are sore. I mean, that could be a valid answer to that. As far as feeling pain more intensely on the right side of your back, it could be that there might be, some sort of structure that might be aggravated back there that wasn't aggravated on your left side, even though your herniation is on your left side. I mean, it could be a little facet joint being aggravated if you feel very pinpointed pain on your right side of the back. But it depends. Let me know if that made sense, and if I could clear things up, feel free to shoot me a message. Terry asked us within the group, has anyone had experience with total disc replacement as an alternative to fusion for L5S1? I said no. Unfortunately, I have not. Maybe somebody in the group has. I don't know. If you have had experience with this, guys, please reach out to Terry. He's wanting to know. Terry might be getting possible surgery in the future, so that's why he wants to know. Terry, like I said previously, total disc replacement. I don't know if anybody who has had success with it, because later on down the road, um, there's too much mobility of the spine. Like, yes, it's good that your spine is able to move again, but too much mobility is a bad thing, and eventually it begins to wear and tear on other structures. Also, I would worry about the hardware coming out of place eventually. As you get older. In a fusion, at least they put some bone in between the fusion area, and the bones mesh together, and you still have space for your nerves and spinal cord to breathe. I don't know. I don't know how that goes in the total disc replacement. That might be potentially a bad thing. So yeah, hopefully that works for you, Terry. If it doesn't, let me know and shoot me a message. And Elaine asks, she asked us previously in the group. I just wanted to answer again. She said, not sure your experience with acupuncture. I had it done in glutes and low back. Now glutes hurt. Is this normal? It feels like sore muscles. It was my first time. Elaine, as I told you previously, I think it's sore muscles, to be honest with you. Acupuncture is somewhat similar to massage, and I know for a fact, me personally, after massage, man, I have felt some soreness in my muscles, so that's what could be going on with you. It should subside in a couple of days. If it doesn't, then something else might be aggravated. Please let me know if it subsides and if it doesn't. Yeah, I think that's all the questions for this week, guys, and that's going to be it for tonight's live, guys. I hope you guys enjoyed it. I hope you guys were able to learn a lot. If you didn't, I'm sorry. I need to do a better job of teaching. But guys, in the comments, if you can, before I end this live, please type it in the comments if you get to watch this video later on. If you watched it live, type in live so that I know you were on here live. If you watch it in a replay, type in replay in the comments. That way I get to know that you guys watched it as well. And that way, later on I get to check back. Every time you comment, it gives me a uh, a message, a notification in Facebook, and it lets me know that you guys were checking this out. And I really appreciate it when you guys watch this stuff, because this stuff is hard to set up. But I feel like this is important for all of us to know and learn about. So yeah, type that in the comments. Type in live or replay if you watched it as a replay. And also in the comments, please type in your biggest takeaway from this live call. What did you learn? What did you take away the most from this live call? Even if it was one little thing, even if it was that Josue's favorite monster truck used to be the Gravedigger. What was it? You guys, please comment in the comments. And with that, guys, that's it for tonight's live. Thank you all for being and thank you all for spending your Friday evening with me. May you guys be on your road to recovery. If you need help, please reach out. We're all here for one another. That's it, guys. I hope you have a wonderful weekend, and I hope you all have just a good time this weekend and a blessed one. Okay, y'all take care and talk to you guys soon. Woo!